Hi, I'm Karen, and this is the Mental Health Hope You're Not Alone podcast. This space is all about breaking the stigma of mental health, where we'll share personal stories, helpful online resources, and meaningful insights, all with one goal in mind: to remind you that you are not alone in your mental health journey. Welcome back to the Mental Health Hope You're Not Alone podcast, and I'm your host, Karen. And I want to say thank you for joining us today. We are going to be talking about major depressive disorder and high functioning depression. And we're going to talk about how those differ and what we can do to help with both. So let's just dive right in. I'll give you a little bit of history here. And the reason for today's podcast is because over the course of the last year or so, I have realized that I think I originally was having high functioning depression because I was going to work and I was doing what normal people, I say normal, that's not true, but I was trying to live as normal as possible, which I was failing miserably, let's be honest, because I wasn't getting out a lot. But nonetheless, over the last year or so, I think I have now gone from that to major depressive disorder, even though I am diagnosed with major depressive. And so I want to talk about that because I think a lot of people certainly deal with depression and are high functioning, and makes it difficult for others to see that they're struggling. And so we'll also talk about signs that you can look for to see if somebody is struggling. This is an article from the Mayo Clinic, and this is a description and overview of what major depressive disorder is. And so, depression is a mood disorder that causes a persistent feeling of sadness or loss of interest. Also called major depressive disorder or clinical depression, it affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. Ding, 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 physical problems for me. You may have trouble doing normal day-to-day activities, and sometimes you feel as if life isn't worth living. More than just about the blues, depression isn't weakness, and you can't simply snap out of it. Depression may require a long-term treatment, but don't get discouraged. Most people with depression feel better with medication and psychotherapy or both. And so this is a part two of the episode that we released a couple weeks ago, where we talk about how to find a counselor and what different types of counseling there are. And the reason for this today is because I wanted to piggyback on that and talk about two types of help with depression and anxiety. And this is what counselor has been working with me on, and I thought this would be a really great way to do a part two. And the symptoms of major depressive disorder are feelings of sadness, tearfulness, emptiness, and hopelessness. Angry outbursts, oh yes, I have that. Irritability or frustration, even over small matters. Loss of interest or pleasure in most or all normal activities such as sex, hobbies, and sports. Sleep disorders, including insomnia or sleeping too much. Right here, sleeping too much. Tiredness and lack of energy, so even small tasks take extra effort. Oh my gosh, that's so true for me. Reduced appetite or weight loss or increased cravings for food and weight gain. Yes, that's me. Anxiety, agitation, and restlessness. Slowed thinking, speaking, or body movement. I do have slowed thinking, which is really a double-edged sword. I also have a disability that makes me think differently than others, and so having that plus the depression doesn't help trying to learn new things. Unexplained physical problems such as back pain or headaches. Oh yes, that's true. Let's see, so symptoms in older, and it does have children and teens on this, but since I'm an adult, we're going to be talking about that. But memory difficulties and personality changes. Yes, for me. Physical aches and pains, fatigue, loss of appetite, sleep problem, interest. We just talked about a lot of these, but often wanting to stay home rather than going out to socialize. Oh my gosh, yes, for sure. and so on. That is major depressive disorder. And now we're going to talk about high functioning depression, and we'll see how much they differ. Depression looks like or feels like the overwhelming cloudiness and hopelessness that never lets up, that hard to shake belief that the world would be better off without you. Often people with depression can't always keep up with the demands of day-to-day life, like holding a steady job, having meaningful friendships and relationships, or keeping their house organized. Their depression can make sure a Herculean effort, and that starts to slide. I will say that's true for me because I have allergies, and so dusting and things are just hard to do. But then because I don't do it, then it makes it worse. So it's again a double-edged sword. Things feel overwhelming that I have to, like right now, I have to this weekend probably sweep up the dog hair that's downstairs because my dog shed quite a lot. But just the thought of having to do it is very overwhelming. But I know I'm going to enjoy it when it's done because it will make the house look nicer. So again, it's like one of those things where it feels like a huge undertaking. Depression isn't always something you can see in others and pinpoint easily in yourself. For some people, depression lives under the surface. It can be extremely challenging to go about your day to day, but the rest of the world, you seem to be doing reasonably well. Some people refer to that as high functioning depression, as in you're living the depression but still keeping up with the demands of your life. And I think at one point I was doing that, but I've continued to get worse to where now it's major depressive disorder. Because I think when I first started having depression issues and anxiety issues back in 2020 and 2021, I was working from home, if I remember right. I was still working. I didn't have a lot of friends either. I do think though, because I was getting out and I was going shopping and doing things like, I don't even do that now. I get everything delivered. So anyway, so what is high functioning depression? High functioning depression isn't a formal medical diagnosis, but it can be a helpful way to describe how some people live with symptoms of depression while managing to keep a relatively stable life. A person with high functioning depression may have similar symptoms as a person with clinical depression or major depressive disorder. Helpless or hopeless, becoming disinterested in things that are used to bring them joy, change in eating habits like eating too much or too little, trouble sleeping or sleeping too much, difficulty concentrating, negative thoughts about yourself and others. And so really, and we'll talk about this, but just by reading this, and again, I don't read this until I record because I want a genuine reaction, but it seems like really the only difference between somebody with a major depressive disorder and high functioning depression is the fact that one gets out and tries to live a normal life, where the other one kind of becomes reclusive and doesn't really interact with much of anything. The difference between major depression and high functioning depression is that it's common for people with major depression to have trouble taking care of things in life that need their attention, and I would agree with that. But high functioning describes people who may live with similar feelings as people with major depression while managing to keep up with their responsibilities. Good for them. I tend to just let it overwhelm me and don't have the ability to do things. Like today, I got out of my bed at 3 o'clock this afternoon because I had no desire to get out of bed. And even when I knew I had to get out, I still lay there for another hour because I was just like, I just didn't feel like I cared enough to get out of bed. Anyway, you may think of high function like a duck gliding on a pond. On the surface, it seems that they're getting around gracefully and easily, but below their feet may be failing to keep up, and they're just trying to stay afloat. A person living with high functioning depression may hold a steady job, parent responsibly, keep up their home and pay their bills on time, tasks that may provide challenging for people with clinical depression or major depression disorder. And that is so true for me in a sense that I tend to not care about my bills. And this is not me at all. Years ago, I used to keep on my refrigerator a tiny little whiteboard that I had all of my bills on, and I would go through and check off as I would pay my bills, and it helped me budget. And I still do something like that similar, but I keep it in a document. However, now I tend to not care about my bills or being late. They're still paid. It just may be a little late. I tend to pay my cell phone bill late. And I don't know if it's because it's my first bill of the month or what, but like right now it's 4/11, and this is, I think it's due here in a couple of days, and I haven't even put it in yet. And I do it all online, so yeah. It'll get done. It'll get paid. No worries. I don't care about paying the extra either. It's like $1.50 or something. I don't care. Anyway, it happens. Depression can be caused by several things. Some people are devoted to depression, hormone imbalances can be led to depression in others, and some people, depression can be triggered by stressful or traumatic life experiences. That is me. But what causes some people to experience debilitating depression while others are higher functioning? It depends. Severity of depression. Dr. Potter explains that depression has several subtypes that range in severity. So, for example, people living with persistent depressive disorder, PDD for short, have milder symptoms than people diagnosed with clinical depression. Masking. People with high functioning depression may feel an enormous amount of depressive symptoms, but it could be that they're able to mask or hide their depression from people around them. And I do that. Holy smokes, I do that. I do that when I'm out. I do that when I'm working. I do that just overall in general. Like, I don't tell my family how I feel. I think my friends know how I feel. Like, I'm more open with them than I am my family. But when I go to meetings, if I am like depressed or just not feeling it, I don't let anyone see that. I tend to act like nothing's wrong and just move on with the day. But just, I mask all the time. And to be honest, it's exhausting to do that. And to be that depressed, but putting on a happy face, it's just completely exhausting. So, hidden dysfunction. Some people with depression may not be as high functioning as they appear. While they may seem to be excelling from your vantage point, it could be that depression is keeping them from functioning in other areas of their life, domains that are hidden from you. That's to say, the signs of depression are there, just not viewpoint. As your coworker may be excelling at work, but you don't know what you don't know is that they barely get out of bed each weekend. Oh yeah, that's me. I try to do something on the weekend, whether it be something for the house or something like this, and recording an episode for the podcast. I woke up at 3 o'clock today. I've had 2 different naps, and that's because I got woken up the first time because of my dog. And to sleep in really late. Like, I'll get up early tomorrow, but then I'll take a nap during the day. So I do spend the majority of my weekend sleeping, which is why, in my opinion anyways, that it's taking me as long as it has to get things done around this house. I just finished up my bathroom. My little half bath that's on the main level, no shower, just a toilet and a sink. I did redo everything in that bathroom. It's a long list, but nonetheless, it took me a year. And I think had I worked on it continuously, it would have taken me just a few months, not like an entire year. But at the same time, I'm the only one that lives here, and I don't care what the state is of it. And so I didn't care that it was taking that long. And then also, too, I didn't really have a vision for the bathroom. It took me a while to research the colors and what I did to it, and so on. Some research and time that was put into just an overall look. Nonetheless, it's finished for the most part. Still a couple of things to do, but it's extra, I would say. So, how to treat high-functioning depression. Let's be very clear. Even if you have a loved one that appears to be high-functioning, all depression deserves treatment. You don't have to hit rock bottom before looking for a way up. The trouble is that high-functioning depression can be hard to spot, even in yourself. People can often disbelieve their own emotional experience. If you're pushing through and managing to live productive, it can be tough to recognize it yourself. And if you're keeping up with your commitments at work, friends, and family, it's less likely that people around you will urge you to seek treatment. I get that, because you're basically normal. So what happens? You can continue to try to keep up, but every task demands more and more of your dwindling energy reserves. That is so true. Something I have been thinking about with respect to energy is lately I've had no energy. And I'm wondering, because of the depression that I'm going through, that like I exhaust all of the energy that I've stored up. Like for example, a friend and I went to a concert a few weeks ago and it was a blast. It was so fun. And I haven't done anything since then. I haven't even barely left the house. And I'm wondering, did I use all of my energy and that night to go to this concert? And now I'm in a place storing it? I just don't know. But it certainly feels that way. Anyway, without treatment, depression can get worse, which I agree. So even if you're keeping up now, that doesn't mean you'll necessarily continue. Interesting. So it seems that the difference between major depressive disorder and high functioning depression is that one still feels very depressed and the symptoms can be very similar for both, but one is actually getting out into the world and doing things and keeping a regular schedule, where the other one tends to become reclusive and staying inside, which that's me for sure. So one of the things, so like I mentioned earlier, we talked about a variety of different types of counseling, and I recently started going to a psychiatrist, mainly just to see if I'm doing okay with my medication. Really, no other reason than that. And he recommended a few different types of counseling. And I ended up talking about that with my counselor. And I almost felt like I offended her because I was talking about getting another counselor. What I found out by talking to her is that she does a form of cognitive behavioral therapy. And that is one of the types that my psychiatrist recommended. It's called exposure and response therapy. And then the other one is acceptance and commitment therapy. So we're going to talk about those two as maybe options of ways to support anxiety and depression. Acceptance and commitment therapy, or ACT for short, ACT, and is a type of mental health therapy that helps acknowledge your relationship with your thoughts and feelings. You learn to understand your feelings instead of changing them. You'll work on reframing your values and adjusting your behaviors to better match them. And that's true. One of the things that we've done, and I will say I am failing miserably because I tend to not follow up because it probably would help me. But with this, she talks about values and what my list of values are, and trying to make decisions based on those values. So, for example, it will be like, say, being healthy and active is a value of mine. Probably wouldn't guess that by looking at me, but it's true. I've been active most of my life. And I was a swimmer in high school, and then in 2010 I started running. 2012 I started doing triathlons. And over the course of the last several years, I have become extremely inactive to the point where walking up and down the stairs is difficult. And so what she's trying to get me to do is to recognize the feeling that I choose to stay in bed and doing, like walking my dog. And quite honestly, I don't know what feeling it is, but what I do is I just choose to stay lazy. And we just talked about this the other day, and she was like, "Well, you, I calling you lazy." I'm like, "You're not, because it's true." And I am. I don't do anything. I rarely even get out, and I need to start doing more. Especially plans coming up in June that's going to require me to walk a little bit, and I need to be able to walk. With the concert that I went to, I kept telling myself, like from January to March, because the concert was in March, I was like, I got to get out and walk because I got to be able to walk around the venue and stand at the concert and so on. And I did. And so it was really uncomfortable. There were times where I had to sit down because my back was bothering me. So I just don't want to do that anymore. And so anyway, so that's the things that we're working on, is really trying to figure out values and choosing to do the values over not. So anyway, continue on here. What is acceptance commitment therapy? Acceptance commitment therapy, or ACT for short, is a type of psychotherapy that helps you move beyond negative thoughts and feelings in a meaningful way. Accepting that your thoughts and emotions are an appropriate response to certain situations. Committing to making changes in your life that match your values. That's what I just said. And so that's another thing too with respect to accepting your thoughts and feelings. So one of the things that she's had me do is like recognizing something the feeling, I don't feel like getting out of bed today, and then doing the opposite. And so recognizing what it is that you don't want, that you basically, your feeling of not doing something that fits your values, and then doing the opposite. So anyway, it's been hard for me because I don't really know if the feeling is supposed to be recognizing. The other day she goes, do you feel heavy? And she didn't mean weight. She meant, is it overwhelming, or is this to feel heavy, like you can't get things done? I was like, yes, I guess heavy would be a good explanation to that. And we've been this 4 months. She has to be tired of talking about it with me, because it seems like every conversation is the same thing. But she did give me assignments, like I'm supposed to get out once a week and walk my dog, and then I'm supposed to do Pilates this Wednesday for the first time. I was supposed to do it a couple weeks ago, but I ended up not doing it because I was sick. So I rescheduled for a couple weeks. And I'm really good at rescheduling. I tend to do that a lot. A lot. Acceptance commitment therapy treats addiction, anxiety disorder, depression, eating disorder, OCD, PTSD, social anxiety, and stress. Which really, I have a lot of that. But you have to do the work to make it worthwhile. I do it for a couple weeks, and I feel like I'm doing great, and then something happens, and I'm like, nah, I'm staying in bed this week, or whatever. I wonder too, I've been really tired, and I'm wondering if it's because of my new medication. I've been on a couple of medications that's supposed to be helpful with having energy, but then my psychiatrist doubled another medication that I was on that's I think it's for depression, but I've been really tired lately. Anyway, so treatment details. What happens during acceptance commitment therapy? During your first session, you'll meet with your therapist. They'll learn more about you and who you are and your goals. They'll give you more information about what you can expect and plan a timeline, and what you'll be working on during each session. You'll be given a lot of information at first, which can seem overwhelming at the start of each session. You'll review what you went over the week before, so don't forget it. Which we go every 2 weeks, so I tend to forget that. You'll be able to ask questions at any time during the session. Acceptance and commitment therapy focuses on learning about yourself and your values. Each session is a little different. You'll be practicing various exercise techniques. And one of the things, this is going off of the values, therapy focuses on learning more about yourself and your values. Each session is a little different. You'll practice various exercises and techniques that help you set and achieve personalized goals, be more mindful, define your values, explore your thoughts and feelings, and adjust your behavior. It's exactly what we've been doing. What are the 6 processes of ACT? Acceptance. So you accept that you'll have a range of thoughts or emotions that can be positive, negative, or anything in between. Cognitive diffusion. You detach or distance yourself from negative thoughts and beliefs. You see a thought as a passive event instead of the truth that drives your actions. Being present. You focus on how you feel in the moment. You minimize planning for future what ifs, so you can see more of what's happening around you. Self as context. You see yourself as a whole person with an identity. Values. You set your own standards that you want to live up to. These values are yours and not driven by the influence of others. Commitment actions. You make changes to help meet your goals, and these goals should align with your values. What we've been doing. tend to be failing, because how many times that I've been assigned or given homework to go out and be active? A lot. The other thing that my counselor and I have talked about and that she used to do with me is exposure and response prevention, or ERP therapy. And exposure and response prevention therapy helps you face fears in a safe, step-by-step way. It's the gold standard treatment for obsessive compulsive disorder, which I don't have. But in this behavioral therapy, you practice being around things that make you anxious, like certain thoughts, images, and situations. And this is true. So basically, it's like exposure therapy. It is exposure therapy. It's in the title. But, like, for example, I was telling her on the way to the concert a few weeks ago, I started feeling like I was going to have a panic attack. And I don't get them often, and they're not as full-blown, I say, as the one I had 25 years, which was unrelated to everything that's occurring now. But I started feeling like my heart was racing, my face started to feel like it was going numb, and thankfully I had a really awesome Uber driver, and he just kept talking to me. He didn't know what I was going through. I was masking. And he just kept talking to me, and being distracted with that conversation helped pull me out of my body going further with respect to having a panic attack. And so that type of therapy is what she's wanting me to do. She's wanting me to go off and do different things that cause anxiety. And like we talked a few episodes ago about how my world has gotten smaller as my anxiety and depression has increased. And so, for example, I used to do normal things, and now I don't do anything. And my world is really just these four walls of my house. And so she's trying to get me to go out and do things. So things like ACT, where I'm trying to live up to my values, also allows me to get out in scenarios that cause anxiety. But again, I'd fail both because I just struggle getting out of the house. I just tend to choose the lazy option. But anyway, so it's this behavioral therapy. You practice being around things that make you anxious, like certain thoughts, images, and situations. At the same time, you are kind of avoiding the fear of turning to rituals, which I don't have rituals. Over time, this teaches your brain to handle the anxiety. And remember what we talked about too a few episodes ago with the anxiety loop, where you feel normal, you're at a level of anxiety, and you feel safe. You see a threat, you conquer that threat, and you get back to feeling safe, and your anxiety is low. This is supposed to help close the loop. And if you don't conquer that anxiety, you don't close the loop, and things continue to get worse, and they have for me. You feel a short relief from the anxiety, say, for example, if I don't go out, but then my anxiety gets higher because I'm not going out. It's a double-edged sword. Anyway, so what conditions does ERP therapy manage? The obsessive compulsive disorder, which I don't have. The treatment details. How does exposure response prevention work? They can make you feel anxious about an outcome that hasn't happened yet. To feel better, you may repeat certain behaviors to avoid situations, which I do. I don't go out. These actions, called compulsions, which they're not for me, I don't think so. Bring short-term relief. Maybe they are. But over time, this actually makes the obsession stronger. Yeah, in my case, it makes the anxiety stronger. What happens during ERP is assessment planning. Your therapist explains ERP and how it works. They'll ask about your triggers, obsessions, or compulsions, which, again, I don't have any of that. But we did talk about me just in general. Practice exposure, slowly facing my triggers. I think really ultimately the goal would be to get me back to being normal. And I don't know how that's going to happen. So much has happened over the last several years. I don't know if it's because of where I live and how unsafe I feel here. And so I've talked about maybe doing a request to move but still keep the job. I just don't know if that's the right thing. I know I can do my job. I do it every day from home. I just don't know if moving is the right decision. Anyway, processing exposure. After the exposure, you or your therapist talk about what happened and how you managed it. And we did. How I was feeling going to the concert and how I felt like I was having an anxiety attack. So I just need to keep doing that. But it's hard to get out of the house. I have no desire to leave. None whatsoever. Okay, so what are the benefits of ERP therapy? Better sleep, better stress management, fewer symptoms, greater overall well being, less time spent on cycles of obsession and compulsion, more confidence, and stronger coping skills. Yes, yes, and yes. That's interesting. Really, really interesting. Okay, so what I want to tell you is I'm going to link it below. Is like I said, we did an episode on different types of, and I'll link this again in here. Also, I will link the episodes that we did. It was really great. There were things that I didn't. You always hear about a few types of therapy, but there's a huge therapy that you can take. It was shocking how big it is. That too, along with everything else that we've talked about. But that's all I have for you today. This was a short one. Thank you so much for joining us today. I really appreciate you stopping by. And as always, I hope you've learned something on how to manage your anxiety and depression. And we'll talk to you in a couple weeks. Bye. If today's episode of Real Stories, Real Struggles, and Real Hope resonated with you, please like, comment, and subscribe. Your engagement helps others find this space and feel less alone.